Health Innovation Ecosystem, a way forward to combat antibiotic resistance. Antibiotic resistance is a global problem that causes sufferings to millions. Like many developing nations, Bangladesh is also vulnerable to antibiotic resistance due to lack of monitoring and integrated data technology and inferior healthcare standards. Patients purchase antibiotics without consulting with doctors, which results into the misuse and overuse of antibiotics. According to the World Health Organization, antibiotic resistance leads to higher medical costs, prolonged hospital stays, and increased mortality. To impede and control the proliferation of antibiotic resistance in Bangladesh, CRID USA, along with Directorate General of Health Services, ICT Division Bangladesh, IDEA Project IBA, BMSS, AUST, DIU is introducing a program titled Health Innovation Ecosystem, a way forward to combat antibiotic resistance. More than 15,000 medical students and 4,000 Bangladeshi doctors will voluntarily join the initiative to further the cause of preventing antibiotic resistance in Bangladesh. Non-resident Bangladeshi doctors will also contribute to the project to make it a success.
But the question is how the health innovation ecosystem will work.
First, we will identify some drug stores or pharmacies in rural areas of Bangladesh for our pilot project and bring them under our program by installing our Cambi Pharmacy mobile applications. Our app will be pre-installed in the devices of the pharmacist. When a patient will visit the pharmacist for the purposes of purchasing antibiotics without a prescription, the pharmacist will connect the patient with the doctor through our mobile application. In order to connect with the doctor, the pharmacist will input the patient's name, age, sex, contact number, address, brief medical history, and their possible complaints into the mobile application. When the pharmacist will click on pertinent button on the application, the Cambi registered doctor from the doctor pool will receive a notification on their mobile phone. By clicking the notification, they can see the patient request from a specific pharmacy via Pharmacy app. Then, via Cambi Doctor mobile application, physician can see the patient profile, brief medical history, patient complaints, and causes of taking antibiotics. After that, physician receive a call via Pharmacy application and consult with the patient regarding the patient complaints, medical history, cause of taking antibiotics, and absolute need of assessment of antibiotics. After a short call with the patient, physician input his comments in a doctor application and prescribe antibiotic if needed. The pharmacist will assist the patient during this process. The pharmacist will receive the provisional diagnosis and ideal antibiotic provided by the doctor through the Cambi Pharmacy mobile application. Then the pharmacist will input the diagnosis and the prescribed antibiotic into a pre-made prescription paper template and provide the prescription to the patient. A text message will be sent to the contact number of the patient providing all the information regarding the diagnosis and prescribed antibiotic. Finally, the pharmacist will then sell the prescribed antibiotic if it is recommended by the physician.
Overall, health innovation has a crucial role to play in preventing antibiotic resistance. By reducing inappropriate antibiotic use, developing alternative therapies, and improving infection prevention and control measures, we can help preserve the effectiveness of antibiotic for future generations.